often have to deal with patients who have a problem with balance, and these are very commonly elderly patients. They've been to many different physicians looking for an answer for why they have a shuffling gait, why they don't have the same balance they had when they were younger. But when I ask them if they've got spinning dizziness, spinning vertigo, that's not the case. It's just they have a problem with balance. And more often than not, the diagnosis becomes one of disequilibrium of aging. And by that I mean a number of systems age. In order to stand up, we're the only animal that can stand on 2 feet. And it's a highly integrated neurologic function that we take for granted. But in fact, what's happening is that we have input from the gyroscopes of our inner ears, and most people think that's the only part of there is to balance, but that's only one part of it. What the messaging I'm getting from my inner ears of what's happening to me in space correlates with what I'm seeing with my eyes, and it better agree. And it also correlates with what messaging I'm getting from my bones and my joints. So as I'm looking at you now, if I put my arm to the side and don't look at it, I know it's straight. I don't have to look at it to know it's straight. I know it's at a right angle. I don't have to look at it to know it's at a right angle. I'm getting a tremendous amount of messaging coming from my bones and my joints, including my legs, including my feet, my ankles. And that is integrated with what my ears are telling me and what my eyes are telling me. What happens with age, just like we have diminished hearing and we may have some problem with our vision, well, we get some aging of what's going on with the inner ears, and we also have some problem with the messaging coming from our bones and joints. A lot of people will have spinal problems. A very common thing in elderly people is spinal stenosis, which gives them, among other things, this lack of input from their lower extremities, and it affects their balance. So the disequilibrium of aging is not something that we can treat with a medicine, and it's not an unexpected consequence of aging. It's a normal event. Nobody wants to have a problem with balance. It turns out that there are physical therapy maneuvers that people can be taught in order to try to stimulate the brain to pick up the slack. Luckily, the brain has a tremendous reservoir of tissue that isn't always used, and if we can call some of that into action to help us with some of the functions that are not working as well as they used to, and we call that using the plasticity of the brain, we think that the balance problem can be somewhat mitigated. Can't make it go away, but we think we can help it. So if you have this problem with balance, and we would like to give you everything possible to improve it. So we would want you to wear better shoes so that you can feel the ground better, so to get better messaging from your legs and from the periphery. We'd want you to get your eyes tuned up and make sure that your glasses are the best you can have so that we get the visual input as optimized as possible. And in terms of lifestyle, we want you to keep moving. It's those people that don't keep moving that don't get that extra bonus as the brain begins to compensate for these diminished sensations from the periphery.